Hello everyone, and welcome to the fourth lesson of health and wellness in older adults. So today, or I don't know if you've been binging all these lessons or what, but anyway, today for this lesson, we're going to look at the top 5 worst chronic illnesses, okay, for older adults. So let's get started. So what is a chronic illness anyways? What's the nature of a chronic illness? Generally, a chronic illness is incurable, okay? Usually that's what it is, especially when it hits old age. So anyway, chronic illnesses are usually something that is not curable, or at least it's going to be very long-lived. You may have to this is going to be something that you're going to live with and you're going to have to maintain, okay, over time. And your chronic illness may worsen over time. It may also, if you're not maintaining yourself with your chronic illness, you could have episodic events, could cause random sporadic things to happen to you, okay? So anyway, so what are some causes of chronic illnesses? Usually it's due to poor lifestyle choices, but it can also be due to heredity, okay? Chronic illnesses are the major cause of death. They are the most common type of disease that we have as Americans in this country. Majority of the healthcare costs that are driving up our healthcare expenditures in this country are due to chronic illnesses. Chronic illnesses will result in a reduced ability to function. Eventually, that's kind of the road that you will go, especially if it's not carefully maintained. Okay, bad health habits, even psychological thinking habits and emotional habits that you have put people at risk for contracting any kind of chronic illness. Okay, so some psychosocial aspects of chronic illnesses. Okay, so because chronic illness is ongoing, older adults have to try to maintain a normal life, even when they have chronic illnesses. Because if we allow, or if older adults just allow themselves to hold on and to play the sick role, this is not going to benefit them. They're just going to start deteriorating even more. Their chronic illnesses will get even worse. If you play the sick role, that means you're not maintaining and you're not trying to hold on to your function. Okay, so caretakers should not allow their patients to play the sick role. It's so important to have older adults and other patients with chronic illnesses to stay away from the sick role and to maintain a normal function as much as possible. Okay, you should not be laying around all day just because you have a chronic illness. You should be trying to make do and adjust and maintain your condition so that you don't get worse and that you can maintain what functionality you do have. Okay, so failed help can be very harmful to the patient, and the caregiver and healthcare professionals need to watch out for it. Okay, because the more a patient gets worse, the more that everyone else has to endure as well. Okay, so older adults have to cope with a lot of chronic illnesses in many different ways, depending on who they are and what their lifestyle is and all of that. Let's move forward. Hold on 1 second. It's getting dark in here. Okay, so the 5 major killers, chronic illnesses. First, we have heart disease, then there's cancer, then there's stroke, then we have COPD, which is chronic obstructive pulmonary disease, and then there's diabetes. Okay, so heart disease. Heart disease is the result of the blood vessels' inability to carry oxygen and nutrients to the heart, which allow it to pump efficiently. Okay, remember I said that in a previous lesson, that's what blood does, or that's basically the whole function of the heart, is just to get that blood to all the different, so the blood can bring oxygen and nutrition to all the cells in the body. Well, the heart also needs that nutrition and oxygen, okay? Even more so than a lot of the other cells, okay? So if blood vessels are not able to carry sufficient enough oxygen and nutrition to maintain the heart, then the heart's going to have a hard time getting all of that, being able to pump efficiently and getting all the nutrition and oxygen to all the other cells in the body. Okay, so risk factors of this are age, gender, race, family history, and lifestyle. Okay, so a huge way that you can prevent heart disease is to stop smoking. That's one of a major causal factor for heart disease. Okay, that's a huge one. Remember how I told you before in a previous lesson that what smoking does is it narrows down your blood vessels. Okay, it makes them smaller and makes them more enable for them to be able to put nutrition and oxygen and all your other organs. I know we talked about skin before, but the heart is just as important, if not more important, to get all that oxygen and nutrition, and nicotine affects that as well, affects the blood vessels' ability to get oxygen and nutrition anywhere in the body. Okay, so that's a huge factor in heart disease. Although not everyone who has heart disease it's not always going to be caused by smoking, but if you are a smoker, that's definitely going to be a contributing factor to whether or not you have heart disease in the future. And it's preventable. Okay, so anyway, so heart disease and high cholesterol. Okay, so there are no symptoms associated with high cholesterol. First let's look at cholesterol. There's LDLs, this is your low density lipoproteins, and then we have the HDLs, your high density lipoproteins. Your LDLs are your bad cholesterols, your HDLs are your good ones. The HDLs are the good cholesterol that you can get from like avocados and things like that. Those are your omega-3s. Your LDLs, that's the other cholesterol, the bad cholesterol that you're going to get from like animal fat and things like that. Okay. So anyway, interventions is by lifestyle changes first. Okay, so that's the best way you can prevent heart disease caused by high cholesterol, is to change your diet, use medications as a second option. But first and foremost, you probably want to always go with the most natural option. That's always the healthiest, the best way to do it. And then at last resort, well, depending on whatever your physician will say, then you use medications. But you should stress to the physician that you would rather take a more natural route first. Okay, and your physician can definitely help you with that, or even let you know and say, like, your condition is too risky. We can't go the diet route, the natural route. We have to go to medication. And if that's the situation, that's the situation. So, of course, see what your particular situation is, and figure out what the best course of action for your physician or with your physician. Medication seems to work on all age groups equally well. However, like I said, you don't always want to keep putting medication into your body. because there can be side effects, and also the more medication you're constantly taking, the toll that you're putting on your kidneys. Remember, our kidneys, that's that filtration system. Okay, and if we put more wear and tear on our kidneys, then they're going to have a hard time filtering through toxins and things like that, and you could get other problems associated with that later on. So it's always best to try to go the most natural route if possible. Anyway, so heart disease and hypertension. So hypertension also has no symptoms. Okay, so it's called the silent killer, which is quite scary. Women are more likely to have hypertension. Weight loss is probably the best way to reduce your blood pressure, so reduce that hypertension. Okay, weight loss. Medications can also be prescribed. It will usually have to be taken for life. Like once you get started on it, you can't really get off. You can't just be like, well, I feel fine, I can just get off my medication now. No, you have to go to your doctor, and most likely you have to do this for life. But usually, if you do want to come off of your medication, you and your physician can work out some sort of tapering schedule, okay, to get off medication. If you can get off medication, okay? So if it's okay for you, then you and your physician can work on getting you on a tapering schedule. Do not ever just get off medication like this. Because this has to do with your heart, okay? And the rhythms and the changes of your heart. You do not want to screw that up. Anyway, next we have atherosclerosis. Okay, so this is a slow, progressive condition of the blood vessels. Okay, arteries will become narrowed due to buildup of fat and cholesterol that causes inflammation. So it makes it swell, okay, because it's so clogged up with fat and cholesterol, okay? This is what hardens and causes plaque in your arteries, in your blood vessels, okay? So, and this plaque can break off and clog an artery that leads to a heart attack or stroke, okay? So, to treat something like this or even prevent something like this in the future, you lower your fat intake and your cholesterol levels, and also losing weight. That's probably the best way to prevent atherosclerosis in the future. Then there's angina. Okay, this is where the heart muscles cannot get enough blood, and this causes a lot of pain. Okay. This causes a lot of pain in your heart and whatnot. So how we can avoid this would be to change a lot of our health behaviors. Okay, diet, exercise, things like that. Let's stay away from the fatty foods, things like that. And also there are medications that can sometimes be used as well if you can catch this early on, and they can be like, hey, we're looking at something like this is building up. Also, surgery might be another treatment option. Okay, they can spot this and open up your blood vessel through surgery. Okay, so then there's heart attack. Okay, so this is where a part of the heart like starves and dies due to the supply artery becoming completely blocked. Okay, so this is where a part of the heart starves and dies because there's the artery that supplies the heart with the oxygen and the nutrition and all of that, and that becomes completely blocked. Okay, so it's not able to supply the heart with, any kind of oxygen and nutrition, and then if the heart isn't able to get anything, then it's going to die and get a heart attack. So heart attacks, they're, especially now, they're not always going to be fatal, but they can be, especially with older adults. Okay, so at the first episode, an aspirin should be chewed and the patient should seek medical attention immediately. Okay, some treatments that may be used would be an angioplasty or a bypass surgery. Okay, this is given in the hospital following the heart attack, but also at home to prevent something like this from happening. You would have to change your diet. Okay, eat very well, heart-healthy foods, eat things that will eat things that are more cleansing and healthy and clean for your body, not necessarily things that are going to bring in more plaque and all of that. So anything having to do with bad LDL cholesterol or any kind of like heavy like animal fats and just grease, a lot of sugar, just things that are not good for you. Keep those out of your diet. Okay, and then of course exercise. And then yes, taking medication. If you are a heart patient and you have been given medication, continue to take your medication. Do not stop that medication. That's actually critical. Okay, so then we have congestive heart failure. Okay, so this is a progressive weakening of the heart muscle that reduces its ability to pump effectively. Okay, so the heart cannot pump blood, resulting in either poor output, blood cannot get into the vital organs, or blood is going to block up, leading to excess fluid. Okay, so there are a lot of things that can happen with congestive heart failure. Could be blocks, could be ways that where the blood is not able to go out to your vital organs or things like that. So ways that we would be treating this would be, of course, your medication. Okay, but also you should take in less fluids, less salt, especially less salt, and then monitor your weight, exercise, of course, and more than likely you definitely need to have a regular cardiologist that you see. Okay, so you can take steps and figure out what to do with yourself early on. Cancer. Okay, so the risk of developing cancer increases with age. It'd be like that. More than half of cancer patients are over 65. And because cancer has no specific symptoms, sometimes it's even hard to diagnose, especially in older people or anyone else really. So it can be difficult to diagnose. And even also, given the fact that many older adults have other morbidities going on, so they may actually confuse cancer symptoms with symptoms that they have, from another disease that they already have going on. Okay, so they might not even know that they need to seek help, is what I'm trying to say, that they need to even take any sort of diagnostic test or anything like that. So anyway, most cancers are treatable as long as you catch it in time. Okay, so most cancers are treatable with really high survival rates, as long as we find it in the early stages. If you find it too far later on, then it may be more difficult to stop. Okay, moving forward. Lung cancer. So this is the leading cause of cancer deaths in both men and women. Okay, so some major warning symptoms that we should look out for would be chronic cough and shortness of breath. Okay, lung cancers are, like I said, they're generally deadly. They're the leading cause of cancer deaths in the United States among both men and women. Many times they are caused by cigarette smoking. Then breast cancer. Almost 75% of breast cancer cases occur in women over the age of 50. Okay, so some risk factors that may contribute to breast cancer can be obesity, inactivity. If you have a really sedentary lifestyle, you're just sitting around all day and you don't do anything. Family history, of course. Length of estrogen in your body. If you know that you are estrogen dominant, then yes, you do have more of a risk of breast cancer. So anyway, some treatments that they will use if you have breast cancer would be radiation therapy, surgery, a mastectomy. You can have chemotherapy and hormone therapy. Okay, so in some ways we can try to prevent breast cancer from happening would be to change some of our health behaviors. Okay, taking medications for certain other risk factors as well. Then we have prostate cancer. So almost all diagnosed prostate cancer cases, about 97% of them occur in men age 50 and older. Okay, so that is why once you hit that 50 mark, men typically, they highly encourage you to get your prostate examined. And so prostate cancer can be very slow growing and is the second leading cause of cancer death in men. So it's actually very critical for men over the age of 50 to always be getting your prostate exams. Anyways, those who are diagnosed with prostate cancer can have surgery to remove the prostate or engage in watchful waiting. Also, healthcare professionals, they do need to know the pros and cons of both of these options before for individual patients. Okay, so when you're actually going in to figure out exactly what type of treatment option you want, do you want to lose your bladder? Do you want to just kind of wait and see what happens? Because it may not necessarily be as as malignant or as aggressive. So, but it really just depends. Your healthcare professional need to actually be able to relay you all that information and let you know your specific case and what might be more beneficial for you to do, and what are the risks and possible benefits of both treatment options. So then there's colorectal cancer. More than 90% of colorectal cases are diagnosed after the age of 50. Okay, so some symptoms of colorectal cancer include rectal bleeding, constipation, diarrhea, or weight loss. Colorectal cancer is more prevalent in America than Japan or China. And so that kind of makes us believe that it could be our lifestyle. It could be the types of foods that we're ingesting, that we're consuming, that might contribute to us having colorectal cancer. So colorectal cancer can be diagnosed through a rectal exam, testing of the stool for occult blood, or looking at the colon with a scope. So treatment is usually always just surgery, okay, for this type of cancer. Then we have stroke. So stroke is kind of like a heart attack, but for the brain. So what I mean by that is it's like a blockage, right? There's nutrition or oxygen and whatnot that can't get there, and it's being blocked. Okay, so the brain shuts down in those areas. So anyway, about 2/3 of stroke victims are over the age of 65. The main risk factor for a stroke is high blood pressure. Okay, so, and then treatment for a stroke can include medication that's given daily, aspirin therapy, lifestyle medications or modifications, So just changing your behavior and your lifestyle, consuming the right foods, exercising, doing things like that, less stress. The effects of a stroke are variable, kind of depending on the portion of the brain that is affected and the length of the stroke. Okay. Okay, so lung diseases. Older adults are more susceptible to acute and chronic lung problems, especially if they have been smoking, especially like during their young years or even for a really long period of time, like most of their life and whatnot. Also, if they've been exposed to certain environmental factors a whole lot longer. Okay, so terrible pollution for a whole lot longer. Also, a lot of people back in the old days worked in areas where there was a lot of pollution, or like the environment was not very clean, the air wasn't healthy, and they've accumulated a lot of bad stuff, okay, that have affected their lungs. So anyway, an obstruction of airflow in the bronchi of the lungs that worsens over time causes lung disease. All right, the COPD is a chronic obstructive pulmonary disease. This is an umbrella term for most lung conditions, okay, including bronchitis, emphysema, asthma, all that. So that's when airflow is obstructed in some way of the lungs and it worsens over time. Okay. Next we have chronic bronchitis. Okay, so this is very common among smokers. Chronic cough can be characterized by chronic cough that lasts for 3 months or years or months. So it's irritation of the respiratory tract. It increases mucus production and decreases the airway's ability to clear itself. Okay. Next we have emphysema. Early symptoms of emphysema include chronic mild cough, fatigue, and loss of appetite. Later symptoms will include shortness of breath. Okay, so symptoms are not often seen until the lungs have been greatly damaged, you know. And then so treatment of emphysema would be medications that can dilate the bronchioles, and then a decrease inflammation to improve the lung function. Okay, also oxygen therapy is used as well. Then we have asthma. Okay, so this is where the bronchioles of the lungs are hyperactive and constrict, causing a reduction of airflow. Okay, so some asthma patients may only have symptoms when they are stressed out, or if there are allergens, you know, in the air, or maybe if they exercise. I know my brother has exercise-induced asthma. But symptoms can vary, you know, from person to person. Some can be very mild, some can be very, very severe. Sometimes people can just take great care of themselves and actually make it so that their asthma is very mild or almost not even there. Okay, so some treatments of asthma can be steroids, bronchial dilators. Allergy medicine can kind of also reduce a lot of the symptoms of asthma as well. So next we have diabetes. Okay, so this is a metabolic disorder. It's characterized by difficulty in regulating the production or use of insulin. Okay, by the age of 65, 20% of older adults will have, or 27% of older adults have diabetes. So more than a quarter of older adults will have diabetes. Type 2 diabetes is the one that is going to develop gradually, and it first appears like in middle age usually. This is one that is not genetic. It's developed in life, usually due to poor eating habits and things like that. Type 1 diabetes is the genetic one. So anyway, the type 2 is where the pancreas produces insufficient amount of insulin, but the body cells it produces sufficient amount of insulin, sorry, but the body cells have suddenly become resistant to it. Okay, so they're not picking it up. In that case, they're not able to take in the glucose, right? And so then your blood sugar goes extremely high, okay, because you're not able to, your cells can't soak in that sugar. So anyways, this disease often will have no symptoms. Okay, so many people are going to walk around and not really know that they have it until they actually have major problems later on. So some major risk factors of diabetes will include obesity, family history, diet, and lack of physical activity. Some ways you can prevent having diabetes would be to reduce your weight, eat very well, eat healthy and clean, whole vegetables, whole grains, organic, low-fat protein. Probably stay more away from a lot of animal proteins. Let's have less animal proteins and more plant-based foods would help. Also medications, both oral and injectable, including insulin. And checking your blood sugar on a daily basis. And diabetes does result in complications in almost every body system. So usually it's not always diabetes that is causing a lot of problems. It's the problems that it's usually not diabetes itself, sorry. It's like the problems that diabetes may cause in other body systems, okay, that cause death or other huge major complications. So this is the 7th leading cause of death in older adults. It does increase the death rate for other conditions such as heart disease, stroke, and kidney disease. Okay, and it is the most costly chronic disease that you can have. It is estimated that 1 in every 4 Medicare dollars is spent on people with diabetes. Okay, so this is really driving up a lot of our Medicare expenses, our healthcare expenses overall in our country and whatnot. And actually, it can be quite preventable, and it can be maintained a whole lot better so that it doesn't drive up so much money. So anyway, I hope you guys enjoyed this and learned a lot. If you have any questions, please don't hesitate to leave in comments in the comment section. You can also email me, and there are other forms of communication as well listed in the syllabus. I will see you guys in the next lesson. Bye.